Kung Flu Pandas. On the offset of the global pandemic, COVID-19, we are looking to support the health system in Australia by providing isolation spaces. With the number of confirmed cases of COVID-19 rising past 6,000, hospitals might run short of the ICU beds for treatment. The Department of Health and Human Resources is unable to arrange spaces for quarantining travelers flying into and within Australia. Currently, 2,300 intensive care beds are available in Australia. However, there is a potential for a second wave of infection. What happens if we cannot flatten the curve? The demand for ICU beds might escalate, hence making it difficult to meet the requirement. In Australia, there are around 8.9 ICU beds per 100,000 people, which is worse than Italy, where there are 12.5 beds per 100,000 people. This suggests that Australian hospitals do not currently have the capacity to accommodate possible demand for beds, and as a result, the future mortality rate may be much higher than expected. We must immediately take all available measures to rapidly decrease the rate of new cases and radically increase the number of ICU beds before it's too late. We have looked into the potential ways to address this problem. According to our research, there are around 9,444 schools, 43 universities, 1 million homes that are vacant, and several office spaces that are not being used. Let us see where we are headed. It started off with human contact, COVID-19 spread, and became a global pandemic with an exponential increase in cases. So immediate action is required to increase the number of ICU beds, which will thus provide isolation spaces for treatment or quarantine. So here's the solution. The vacant spaces can be put to use effectively by converting them into isolation or treatment centers with the support from the owners. The owners can sublet the empty spaces and in turn receive a compensation. This is a win-win situation for both stakeholders. I will now walk through our implementation, demonstrating how exactly our application works. As an owner of a private property currently incurring losses, I would like to use this app to register my property to be used as an isolation space or a treatment center. Firstly, I would like to sign up with all my details. I'm now going to log in with my credentials. I could now see a home page which shows where we are headed. I now want to register my property. So I am going to choose my property type as a holiday home. I've given my address. I can also enter my availability, which is the from date and to date, and the description. I can enter the property size or number of rooms, etc. I'm going to enter 6 rooms. I'm also going to upload a picture of my property. I'm now registering my property. After registration, I can see the status of all the properties that I have registered. I can see that the properties has been added, verified by the service provider, but not yet by the Australian government, but here it has been verified by the Australian government. But it's still not in use because I have to accept or decline the compensation which is offered. This is the prototype of our application, and our solution is intended to help the healthcare system. Thank you.